I couldn't do anything. I couldn't do anything.
Please help us more. We want help.
How about the feeding? Are you feeding fine?
We are not feeding fine. No. We are only managing.
Don't worry, everything will be okay. And you need to be patient. Patient and pray.
My husband just abandoned us, me and the children, and they went. I don't know where he is now. Since 5 years ago now. So I only stay here with my children. They are 7 in number by the grace of God. But one has died, so remain 6. The child just developed sickness after when we went on the test. They said that it's HIV-positive. I hide it to everybody. Even my mother didn't know. Nobody knows. Because if they know now, everybody will run from you. It's only them that knows it. Even my children didn't know. Nobody knows. So I hide it to every ear. Nobody knows. Talk less of to help. Because immediately they know, then we broadcast it everywhere. And everybody will run. So I hide it. I don't let anybody to know.
In fact, if not for the Catholic Church, I don't think some people will even come out to say they are positive. Initially, I was trained as a priest, but I was not ordained. So I withdrew into public life because of the family problems that have engulfed my own house. The parents of these children you see me with, I adopted them because their parents died of HIV and AIDS. My 2 senior brothers and my younger brother, the first one has 3. The second one has 2. The third one has 3 also, making 8 of them all together. And all of them, their father died of AIDS, their mother died of AIDS. So about 8 of them are living with me. Even these 2 I have with me, they are also infected through mother to child infection.
From our own records, about 80% it's through sexual contact with their partners, and the children we work with transmitted from their mothers.
I lack the words to express the gravity of the AIDS epidemic. Genocide, horror, tragedy. If you just visit any African hospital to see people dying in conditions that they look like they've come out of a concentration camp. It's a profound challenge to our time.
People are not very aware of the basic facts of the virus, so there is still a very high level of fear. A fear in the sense that if I sit beside somebody who is infected, maybe I'm going to get the virus as well. If I share cups or domestic utensils in the house, if I share the same toilet, the same bathroom, if I lie on the same bed, and so on. When we go out to villages to educate people, very often we find out that there are no health facilities in those areas. So we go out with medicines, and where there are sick children, maybe sick mothers and others as well, we provide a curative care. And those who are too sick for us to handle, or maybe those who are at high risk, we bring them back to Mina, where we have the health center for further care.
We call it support group meeting. It's a meeting where all those who are infected with HIV come together to discuss their common problems. This center was established about 7 years ago by the Bishop of the Diocese, Martin Ozoko. The services we give here, we create awareness, we give immunizations, we have a little theater there, and so we conduct minor surgeries.
You see people coming up here every time, in the morning, in the evening, in the night, no time. Sometimes when we are sleeping, somebody will knock on your door and because he has come to share. People confide with us because they know that we are caring for them.
I
believe that 60% of the healthcare in Nigeria is private. Only 40% is state-run. We are responsible for some 320 institutions, large as well as small hospitals. In many cases, Catholic-run healthcare is located deep within primitive village areas, where government healthcare is not provided.
Our problem lies on how to get the drugs. Because we all know that concerning this sickness, it doesn't have cure. But there's some drugs to use, it at least will reduce you boost up your immunity. But here, we don't have such drugs because of lack of money.
Our people also die, maybe because they don't have that enough money to buy the normal food they should eat.
For those who are very sick with the virus, unfortunately, we don't have much to do and we are really handicapped.
So this is the brother we have come to visit, and he has undergone an operation and he's still recovering from the operation, and is one of those that we have facilitated through our work as the outpatients that we do have in the houses. He's at home because of money that he couldn't pay. That's why we have to retrieve him from the hospital to come and keep him at home.
Healthcare is expensive. Also, many hospitals lack proper drugs and the patients have to pay fees. There are few cases in which the government will provide salaries to doctors or nurses working in a missionary hospital. Very often, hospitals cannot hire doctors because there is no money to pay them. Additionally, we have a health policy stating that if a patient comes to the hospital without money, we cannot send them away. We have to treat them and pray that maybe they will pay.
The doctors who give their services, they are Catholic doctors and they do it free.
We cannot carry out this without any support from anywhere. We remain grateful to the Church in Need from Germany for the support they are giving us. The government is not helping us in any way. We have tried to contact the government several times, but it has always been promises, and these promises have never really come to reality. I remember I was involved in the year 2000 in developing the HIV/AIDS policy for the Catholic Church in Nigeria. And I remember at that time, the government didn't even have a policy yet on HIV/AIDS.
The Catholic Church is on the leading edge of treatment in Africa. They're the ones that introduced home-based care of AIDS orphans, and now are on the cutting edge of bringing anti-retroviral treatments. And just as the Catholic Church has been a leader in treatment, it is now becoming a leader in prevention. We know what works to prevent new HIV infections, and that is abstinence before marriage and faithfulness within marriage. And that's been shown very conclusively to lower HIV prevalence in Uganda.
You saw this signboard and it said love is all about responsibility. But anyone looking at that will say, oh, this is beautiful. Yes, love indeed is all about responsibility. But what is the responsibility? It is the use of condoms. They don't talk about the side effects. And you know, for us here, it is even dangerous. Because you see, the condoms, for example, if they are distributed, sometimes one uses it about 3 times, 4 times.